Northern Borno, historically known as the nation's food basket, has been the sector worst hit by a decade-long insurgency, which has severely devastated local livelihoods. The healthcare system is among the most critically affected sectors. In response, Governor Babagana Umara Zulum has undertaken tireless efforts to revitalize it, with both primary and secondary healthcare receiving significant government attention. Notable ongoing projects include the construction of an ultra-modern general hospital in Gajuram, Gubiyo, and the remodeling of the existing facilities across the northern zone. To address the major challenge of accessing specialized care, the Zulum administration constructed a comprehensive eye and dental hospital in Monguno, the headquarters of Northern Borno. This facility provides vital specialized services to communities recovering from the unrest.
It is my singular honor and privilege to commission this eye hospital here in Monguno to the benefit of mankind.
The historic commissioning of these hospitals marks a significant milestone in Governor Zulum's 25-year development plan, which is founded on providing comprehensive health care. These legacy projects are clear evidence of the plan's successful implementation. During the ceremony, Governor Zulum stated that the institution fulfilled his campaign promise to deliver effective, efficient, and affordable health care. The governor announced that the hospital will commence operation immediately with free eye services for 5,000 patients.
It is my singular honor and privilege to be in Monguno today, specifically to commission 3 landmark projects. One, the dental hospital Monguno. 2, the eye hospital Monguno. And then the last but not the least is the School of Nursing Monguno. Borno State was created about 50 years ago. But unfortunately, the state has only 1 dental hospital, public dental hospital, and 1 public eye hospital, which are domiciled in the headquarters of the state. On assumption of duty as the governor of Borno State, we promised to the people of Borno State that we shall bring affordable and quality healthcare delivery systems to the doorsteps of the communities. In this regard, Borno State government has decided to establish dental and eye hospitals in southern senatorial zone as well as in the northern senatorial zone. Consequently, we have established and commissioned dental and eye hospitals in southern Borno, which was specifically located in Biu town or Biu local government areas of Borno State. Today we are here to commission that of northern Borno here in the historic city of Monguno town of Monguno local government area of Borno State. And to the glory of God and to the benefit of this community, few minutes ago we have commissioned the dental hospital Monguno and eye hospital Monguno. We have also plugged up the provision of free services to cater for the needs of about 5,000 persons from northern Borno, for them to be provided with free eye surgeon. And I want to recall with nostalgic what we saw this morning in the eye hospital, where a patient narrated that he was blind for about 10 years because of cataract only. And today, to the glory of God, the man would inshallah see the 4 walls of the eye hospital. Glory be to Almighty Allah for giving us the opportunity to commission these landmark projects.
Recognizing that human resources for health remain a global challenge, the administration has also constructed 2 additional colleges of nursing and midwifery in the state's northern and southern senatorial zones. This strategic investment makes Borno the only state in Nigeria with a public nursing and midwifery college in each of its 3 senatorial zones. Commissioning of the Monguno College of Nursing and Midwifery. Governor Zulum emphasized that this institution is crucial in addressing critical gaps in the healthcare workforce. He also allocated 3 billion naira for the construction, upgrade, and re-equipping of Monguno General Hospital to a specialist status.
We are also here to commission the School of Nursing here in Monguno. Because what matters is not only the construction of the facilities, but the human resources for health is key ingredient that would ensure sustainability of all health projects in the state. And therefore, this School of Nursing will train our younger ones so that they will become nurses and midwives, thereby providing the needed manpower not only to northern Borno but also to southern Borno as well as other states in the Federation. I want to assure you that the living accommodation would soon be provided to all these staffs so that they will live comfortably. However, as an interim measure, the Commissioner for Local Government Council as well as the local government chairman of Monguno local government should put heads together and identify some edifice within the town so that Borno State government will take over this edifice on a rental basis, pending the completion of new housing estates to these doctors. Commissioner for Local Government will also have to identify a site for construction of not fewer than 100 housing units here in Monguno immediately, so that these personnel that are working in Monguno, especially the medical personnel and teachers that are living in Monguno, shall be given a BPT accommodation. You can sit down. And inshallah, we shall commission it, plug up these projects very soon. Furthermore, very soon, we shall plug up the construction of a repeated specialist hospital in the General Hospital Monguno. The BOQ for this project has been concluded. The project will cost the Borno State government about 3 billion naira, the construction only, without furnishing it, without equipping it. And inshallah, this project will soon start in Monguno town, and they will be fully equipped with state-of-the-art facilities like MRI, CT scan, and others that are available in Metropolitan Council, so that the 10 local government areas of northern Borno need not to go to Maiduguri for their medical treatments, inshallah. And I want to assure you that on or before the end of next year, all these projects will be commissioned. What would happen after the completion of this specialist hospital? This hospital that is being run here now in Monguno is now a general hospital. But once this hospital is upgraded to a specialist hospital, that means residency trainings for medical doctors can be undertaken here in Monguno, so that the major problem that we are facing in this region of the state, which is the gap in human resources, can be reduced to the clearest minimum. Inshallah, we shall look into the problems that is facing the health sector in Borno State.
In his welcome address, the Commissioner for Health, Professor Baba Malam Gana, described the ongoing healthcare initiative as a profound source of pride for the state. He expressed deep appreciation for the significant investment under Governor Zulum's leadership and urged parents and caregivers to seize this unprecedented opportunity to achieve universal health coverage.
Today is a milestone. A milestone we gather not only to celebrate a building which is in front of us here, but to embrace a vision that places health and well-being of our people at the very center of our development. The commissioning of the College of Nursing and Midwifery is more than a ceremonial milestone. It is one of the most strategic and forward-looking investments this administration of His Excellency can make in the future of healthcare in Borno State. While modern hospitals and well-equipped clinics are vital, it is the skilled and compassionate hands of nurses and midwives that truly save lives, comfort the sick, and provide hope to families in their most vulnerable moments. Our state, like many others across the country, faces significant challenge in the area of maternal and child health. Too many mothers lose their lives during childbirth, and countless newborns face preventable complications due to shortage of trained and competent healthcare personnel. These tragic losses are not just statistics, they are deeply felt in every family and every community. It is for this reason that the establishment of this college is crucial. By training a new generation of nurses and midwives, Monguno happens to be amongst the 13 local government areas where the burden of maternal and neonatal mortality is high in Borno State. So technically, Monguno is amongst the Mami State as tagged by the Federal Minister of Health. This institution will serve breeding ground for skilled, dedicated, and highly trained healthcare professionals who will become the backbone of our healthcare system. Every student who walks through these halls will carry with them the potential to save lives, reduce maternal and infant mortality, and improve the overall quality of care across our hospitals, clinics, and communities. By producing competent health workers who understand the specific needs of our people, will ensure that no mother, child, or family has to suffer due to absence of qualified caregivers. However, the success of this endeavor is not solely in the hands of government or administrators. It requires shared commitment from the entire community. As His Excellency has often emphasized, I call upon every parent, guardian, and community leader to support and encourage our youth to take advantage of this extraordinary opportunity. Motivate your sons and daughters to enroll, mentor them, and champion their path towards a noble, life-saving profession.
The Commissioner for Health highlighted the government's major investment in cutting-edge educational equipment for the institution.
Borno State lost about 45% of healthcare facilities within the state. And that also means that we have lost considerable amount or number of our clinical staff who were either abducted, who were either maimed, or who had suffered from post-traumatic stress disorder. And this has made life therefore in our clinical scenario rather very difficult, and therefore our staff have been coping with a degree of task sharing, task shifting to be able to cover, which is not the best scenario. As a result of which His Excellency in his magnanimity decided that the number of health workforce must be increased in the immediate, medium term and long term. And one of the long-term approaches is this edifice that you are witnessing today. As you have gone around the college, you have seen for yourselves the gargantuan number of equipments that have been brought in. And this is to ensure that the training received here is the best in international practice. And therefore, it's important that people in this part of the world, when they graduate, they will compete with any of their counterparts in any part of the world. So this is the backdrop to it. As a Ministry of Health, we have been preparing ourselves for the for this school, as well as the one in the southern part in Goza, whereby we have already sent our nurses to Bayrou University, Kano, where they are going to qualify as nurse tutors, whereby they can be able to come and teach here in Monguno and also in Goza.
The Permanent Secretary, Ministry of Health, Dr. Shetima Maina Mohammed, and the Chief Medical Director, Hospital Management Board, speaks about the rationale behind the establishment of the eye and dental hospitals, as well as College of Nursing and Midwifery in Monguno, and commended Governor Zulum for always responding to yearning and aspiration of his people.
Indeed, this is a momentous and historic occasion. One of the major challenges confronting the health sector in the state and universally is human resource in health. And it is to address this gap that His Excellency, the Executive Governor of Borno State, Professor Babagana Umar Zulum, established this College of Nursing and Midwifery in Monguno and Goza. Today we are witnessing the commissioning of College of Nursing and Midwifery in Monguno, which will go a long way in addressing the human resource in health challenge. The institution will train nurses, midwives, and other cadres of health personnel that will contribute to reduction of maternal mortality and then healthcare delivery in the state at large. So indeed, this is a very historic occasion. It's a legacy that will the people of Borno State will cherish for a long time to come. And again, additionally, we have the eye hospital Monguno and the dental hospital Monguno that are also commissioned today. They will provide this specialized healthcare service in dentistry and eye care. Honestly, Borno State is the only state that now has an eye and dental hospital in every senatorial zone. Words cannot really capture our appreciation for His Excellency the Executive Governor for devoting so much to the health sector. As you are aware, Borno State has surpassed the requirement of health financing of WHO of 15%, both in the 2024 and 2025 approved budget, and we are seeing all these developments in the health sector in terms of provision of health infrastructures, just like the ones that are commissioned now, and several new ultra-modern hospitals cropping off in nooks and crannies of the state. General Hospital in Mafa, Dikwa, Uba, Gubiyo, Magumeri, so on and so forth. So I think our immense gratitude goes to him. Then posterity will always judge him for transforming and reforming the health sector in the state.
It is a known fact that the state is gradually recovering from the insurgency, and there is the need for us to make sure that at least all the essential services, those who are resettled in their various communities to have. This is one. And then two, the population of Borno has grown over the years. And the last time the College of Nursing Maiduguri was established is almost about 30 to 40 years ago. And because of the increased number of human resource for health that we need in our health institutions, coupled with the works that the government is trying to establish, so we believe hiring is not the best option but for us to train. And it is in that direction His Excellency, in His wisdom, decided to create the two School of Nurses in Monguno and in Goza. And today we are witnessing the commission of School of Nursing in Monguno. And also the eye and the dental hospitals. The last time, as far back as 1979 or 80, when the eye hospital Maiduguri and the dental hospital Maiduguri was established by the then Governor Mohammed Goni. And if you look at, says the population of Borno is growing, and people cannot travel from all these far local government to come down to Maiduguri to access these services. So equally, it was in that wisdom, His Excellency, feel there is a need for us to establish the dental and eye hospital in Monguno, and then dental and eye hospital also in southern Borno. So in all the senatorial zones, we have, School of Nursing, and we also have eye and dental hospitals, at least to cater for the large, population of patients who are in their need.
I think I'm sort of what to express our lovable governor, the workaholic governor, the governor who has his people in his heart. Now the inauguration of this two sister college, Monguno here and then Waza, inshallah, is one of its kind in the history of Borno State. The College of Nursing Science is the only college providing nursing from inception. But today we are having two new colleges. Not only two new colleges, equipped with modern facilities, beautiful facilities, modern books, modern skill lab, modern laboratory, everything. In fact, we are more than ready for not even accreditation, more than accreditation. We are ever ready for it. We are very, very grateful.
In a related development, stakeholders from Northern Borno, including Senator Mohammed Tahir Monguno and District Heads of Monguno and Gajaram among others, praised Governor Babagana Umara Zulum and the Commissioner for Health for the transformative project and initiatives undertaken in Northern Borno.
I wish to state, without any fear of contradiction and equivocation, that your transformative leadership is unparalleled and unprecedented in the annals of history of our nation. This is clearly manifested by the fact that you have brought governance to the doorsteps of the people by bringing the dividends of democracy across all spheres of life, whether it is education, health, or otherwise, to the doorsteps of the people. These are things that are there for each and everybody to see. We wish to most profoundly thank you for this leadership that is not only grassroots oriented, but jealously guards and protects the interests of the people at grassroots by bringing the interests of democracy to their doorstep.
Who come and do it is Kuzoto Monalo Gaya Mongono Paltina Rodana, La Jungo Monchi, Mamaro School of Nursing Fanjena, Tomorrow Gobara Gomna Kajin, Mukon the Kumaramin Puri Tarishimbe, and Dero Gomna Kamara Budin Sarais and Nambe She Kajin, Mukon the Filam Purson Timi, and Dero Sina Kamara Shembe Kajin, and Nantaroda Izoro Baragomna Ascaniana, who Mongono Roller Bornelan, Yerwa Rumia Blashe Bara is Waldana.
Alhamdulillah, askara kama mai alaro. Anuma shi Monguno shi ma Daudi ala Borno yo. Boron sa ko atalti diwa tatina man to Borno mai su Monguno rozana annan kado turmaro la kalga manna ala Borno sai me war san maso Monguno shi ma Daudi zawo. Da governor Agul sai ba dalin zuru Who Suralete Alan, Turmaro Monguron come Dundia, Yero or Tadin say, Gadramin Dundia, Yero or say, Bagan Dundia, Yero or say, Do Kunalan, I hospital, Kurusari Taritimia.
Governor Babagana Zulum's visionary leadership and unwavering commitment are evident in his administration's unprecedented achievement across Borno State. His strategic investments in critical sectors, particularly healthcare and education, demonstrate a dedication to transformative development. Through purposeful governance and a hands-on approach, Governor Zulum has not only initiated vital rebuilding efforts, but has also laid a solid foundation for sustainable growth and a prosperous future for all citizens. His resilience in the face of challenges sets a benchmark for leadership in the region.